Welcome to the Ask Brian podcast radio show, where you'll hear from some of the most successful founders and CEOs of businesses and startups, sharing their best advice for success and even some stories on how their mistakes actually make them even more successful. Now, here are your hosts, Brian and Tracy.
Welcome. You listen to KHS 1220E and 98.1 FM, the Ask Brian radio show, ASKBRIEN. And every single week, every Thursday, we try to help out business owners, try to help them out with either a new business venture or something that they can learn about their business. And people always ask, why do you spell Brian with an E? Patrick, why do we spell Brian with an E?
Well, I'll tell you why we spell Brian with an E, because there's a number
It's no laughing matter.
You're right. This is a very serious matter. The E stands for almost themes that have to do with the Ask Brian show. One of them was empathy.
What is that?
Basically putting yourself in someone else's shoes.
But you wear a size 14, I wear a size 8, so how does that work?
Well, that means...
Can you fit in my shoes? Really?
No, it's too small.
I think you'd have a problem. Yeah, I think you'd have a problem.
But at least, hey, we tried. Empathy is you try to put yourself in someone else's shoes. There you go. It's the trying that counts.
Yeah, you'll be... I'd like to see
effort.
I'd like to see you walk in my shoes.
That too. But effort, that starts with an E.
Well,
hey-o.
I guess.
Outside of that, we have experts, because everybody on the Ask Brian radio show is an expert in their field.
What are you an expert in?
Engineering.
I thought it was an N95 mask.
It is an N95 mask.
I thought that's what you're an expert in.
No, I'm not I'm not an expert in mask wearing. I didn't design it.
Why are you guys wearing masks? I'm at the freedom. Sorry.
Okay. What? I'm just being
free the
safe.
mask.
I'm just being safe, man.
There's no safety here.
Okay, dear Lord.
This plexiglass isn't going to keep you safe from anything. Plexiglass is a misnomer.
Anyways, ladies and gentlemen, there is expert
laughing a lot.
Experience. Because everybody on the Ask Brian show shows some form of experience, in their field as well.
What experience do you have?
Experience in...
Eating cotton candy is not experience.
That is not what that is. Experience in engineering, social media, marketing. You name it.
You name it?
Thank you, Emily.
You're welcome.
Neurosurgery?
I'm not a doctor, man.
Well, you just said everything.
Everything like that is what I meant to say.
But you missed the three biggest ones.
I haven't even got to the three biggest ones.
What are the three biggest ones? Do we have a drum roll?
We do not. I already know we don't.
Oh, we don't?
Number three!
Number three. Number three. Up. Is it enthusiasm?
Enthusiasm!
Ow. And then the other one is, be ready, Emily, excitement.
Excited, get excited.
And then, am I forgetting one?
You missed the most important one.
What's the most important one? Is it education?
Thank the Lord.
Ha-ha!
Thank you, God.
Because I'm an educated gentleman. Yes, sir.
Not exactly, but what we try to do is we try to educate our audience each week. And each week we try to educate people so that they can learn something about business. And without any further ado, how do you spell ado?
A-D-I-E-U.
And what's the biggest letter in ado?
The biggest letter? Well,
E!
That's
part of the Ask Brian show.
That is true.
I tricked you.
We forgot to include a very important E. Emily.
Woo! Of course. Without which the show could not be done.
Bingo.
True that.
True that.
Okay. Now, we have our co-host. Thank you very much, Patrick. Tracy, you still around?
I'm here. I'm just flabbergasted by all the enthusiasm.
Well, you know what happens when you're not in the studio for a while. This is what happens.
I can see that. I can hear that.
Well, and then we have a very, very good guest today. Her name is Guenevere. Is that Guenevere? Am I pronouncing it correctly or not?
That's correct. Guenevere spelled with 4 E's.
4 E's? Ask Brian. Oh, right. Now she is a total Ask Brian person. With the E's. 4 E's.
If you forget my name as Guenevere, you can just say, give me a beer, because it rhymes with Guenevere. Give me a beer.
Oh my God, we love her already. Multiple E's and give me a beer. What could be better than that?
Going to O'Brien's Pub for the beer. So we have a couple of questions. So we are a pretty serious show now. And the questions we have is, can you give us a little bit about your background?
Sure thing. So I'm a medical coder by trade. I'm also a serial entrepreneur, and I've started 22 different companies, including a national vegan food franchise company. I had a bonsai farm for a while. I'm a licensed drone pilot, a notary, and for the past 10 years, a medical biller and coder.
That's it? I was teasing. Anyway, that's a lot of stuff to be doing. Plus, being a serial entrepreneur, I mean, you must deal a lot with Kellogg's and Post cereals. Now, question for you. The name of your company is what, called Sage? Is that correct?
Correct. Sage Medical Coding and Billing.
And when did that company start?
In 2020.
Did you start it alone, or did you start it with other people?
Well, I was a medical coder, and I began working with, I reached out to a developer with a concept I had to see if the idea I had, so again, as a medical coder, I'm not a software engineer, so I had to see how the concept that I had in mind would roll out as a technical solution.
So that's a question a lot of listeners always don't understand about billing and coding. So can you explain a little bit about how that works?
Sure thing. So medical coders are the individuals responsible for translating physician reports into useful medical code. So these type of professionals work behind the scenes in a variety of settings to ensure that pertinent information is coded properly to be sure that we have a level of consistency and accuracy.
I imagine there's like a book or something, a reference book or something that shows this is how you bill for the lobotomy for Ask Brian or the...
Yeah, exactly. So there's a government organization called CMS.gov, and every year they produce a book with updated medical code. And then we use a series of problem-solving techniques to read over physician files, identify certain medical terms, and kind of sew that story into medical code.
Well, I don't know about you, and I don't want to say anything against doctors, but most doctors that I'm aware of have bad handwriting. So my question is, how do you even read the handwriting?
That's a good question. So these days, physicians typically do not record patient data by hand. It's often entered electronically into what's called an electronic medical record or an electronic health record. So if you think back to the last visit you had with your physician, during that encounter, did your physician spend a lot of time looking at a computer and doing data entry? That often happens during patient encounters. The physician is, doing quite a bit of data entry to record all of the patient information during that visit.
So how does HIPAA affect this? Because, you've got the doctor, and he's giving the information, now he's giving it to the coder. So are you on the privacy rules of the doctor?
We are absolutely restricted by HIPAA to ensure all privacy of every patient record that we encounter.
You started this new company. How are you different than any other coder or programmer? What is unique to your product?
Good question. So let me touch on the problem that we're solving. So if you or anyone you've ever known has received a bill in the mail from your physician that should have been covered by your medical insurance, then you've experienced part of the $100 billion worth of mistakes that are made by medical coders and billers every year. So what our product is doing is eliminating the costly human error while increasing physician productivity by 20%. So the way we do this is instead of having the physician, now, most physicians have gone to medical school for 12 years. The last thing they want to do is sit in an office and do data entry all day. So we've come up with a product that allows the physician to record an audio file. The audio file is transcribed for them in real time, so that eliminates the necessity for lengthy typing. Our AI-driven technology can then scan that transcription and do what a medical coder would normally do, which is generate the correct medical code. That code then goes on to another section of our software-based system that generates it basically replaces the biller, and then that goes off to the payer. Now, in the past, this process had normally taken about 8 steps and could take weeks to complete. We've managed to reduce this to only 3 steps, and it can be done in real time.
Well, that's very good. I mean, obviously, if you can pay out and get the money quicker, that's better for you. Now, the people that are paying the money, they probably don't want to pay it as quickly, but certainly it can be very efficient to do it that way. What is the biggest problems that you've had?
The biggest challenge we're having at the moment is basically feeding the AI enough data to be able to assess for every complexity. And if you think of, millions of humans on Earth, there can be a variety of different problems that those patients can be experiencing. So in order to have, to be able to choose the correct codes each time, our system has to continue to learn, as with most artificial intelligence or machine learning systems. So basically what our biggest challenge is getting enough data to feed to our system. We're constantly improving the accuracy of the system by exposing it to more and more data.
Now, if I heard you correct, every year they are changing some of the code?
So every year they update the code. So assume in the year 2019, we didn't have a code for coronavirus COVID-19, right? Because that hadn't existed yet. So in 2020, they had created a code for that diagnosis because it was a new thing. Now, suddenly a new piece of durable medical equipment can come on the market, right? A more advanced wheelchair, a more, dynamic set of crutches, anything to that effect, casting, all sorts of things that are improved on it within the medical field will have, as they come to market, there will be a new code assigned to those. So any new diseases, procedures, or medical equipment will all have additional codes each year.
So where I'm confused is using AI, and each year they're coming out with new codes. So it doesn't take like 3 months to 6 months before the AI can figure it out because you've got new codes each year?
So there are additional codes that come out every year. So if you were diagnosed with diabetes, that code would stay the same each year. But if a new form of diabetes was diagnosed, then that would be an additional code. So each year, the system is trained on a base set of the pre-existing codes, which are typically, reused every year.
So there's just a few new codes each year. So basically, 90% of it's probably the same, just a couple of codes here and there.
A few hundred new codes each year, but yeah, that's very true.
How many codes are there?
68,000.
68,000? That's a lot.
Mm-hmm.
That's my daily calorie intake, is 68.
Wow.
So how does the computer train itself with AI?
So it has a recurring neural network that is able to improve and learn from each patient.
And how many repetitions do you typically need before it actually starts to come up with the proper AI?
Well, currently the system's trained with over 100,000 data points, so it's quite accurate. It's currently coding at an accuracy rate higher than a human.
Can it audit itself for problems, or how does that work?
So we do a variety of random audit series to ensure that the system is coding at the proper rate.
When you have a problem or something comes up, does it pop up and tell you?
Absolutely. So if there is a mistake made within our system, or if the billing component makes a mistake, then it wouldn't pass through what's called a clearinghouse. So the clearinghouse essentially scrubs the claim and verifies that there's a 99% chance that it will be accepted by the payer. So you can see how this would drastically reduce the amount of denied claims and bills being sent to patients that should have been covered.
So I would expect a typical biller would be entering the data in a database and filling out all the information. With this AI, you avoid that step and the computer program just figures it out? Is that correct?
Yeah. So regarding the biller, the billing system works like this. So let's assume, Brian, that you had Medicare coverage. I don't know how old you are, but let's just assume you have Medicare.
I'm 97 years old.
Okay, then you certainly have Medicare. And let's assume your co-host Tracy has Blue Cross Blue Shield. Now, each of you go to visit a different primary care doctor, and during that visit, you, Brian, received a flu shot. Now, the physician wants to be paid, reimbursed by your medical insurance payer for both the visit and the flu shot. So we can diagnose this, we can assess the procedure, but on the billing end, Medicare is willing to reimburse your physician $65 for that flu shot. Although Tracy with Blue Cross Blue Shield, she's had the same diagnosis and the same procedure, only her billing provider is only willing to reimburse $45 for the same flu shot. So that's where billing gets a little bit sticky, is different providers will, even though they're accepting relatively similar codes, what they're willing to pay and reimburse for those services can be very different. So that is why the billing system, the billing AI is so important, because it's also reducing the amount of mistakes made by correctly assessing which insurance company is attached to that patient and what that company is willing to reimburse today.
And it's the billing, it's the insurance company, whether or not it's Medicare, Medicaid, or Blue Cross Blue Shield, they're making the determination of how much the money gets paid off of each policy. Can they have different amounts for different policies? I got the gold, premium, platinum form, and I get $60 for that one, or you got the Dewey crappy policy, case 30.
So the payers themselves decide what they're willing to reimburse for treatment. So basically, we send them the code with the current billing, or the pay fee schedule that they provided to us. What happens within those policies specifically are not really connected to what our platform does, because each payer, as you mentioned, Medicare, they can change their pay fee schedules at any time.
And who are you selling this to? Are you selling it to doctors, to medical billing companies? Who are you selling this to?
That's a very good question. So currently, our B2B SaaS and server software customers are physician groups, specialty care clinics, chiropractors, behavioral health specialists, and telehealth doctors, although we can vertically integrate with anyone who accepts medical insurance. And that industry alone is a $682 billion industry.
We have our co-host. Tracy, you still around?
I'm here. I'm so fascinated by your background in terms of your multiple different experiences in different businesses and different roles. Can you share with us maybe some of the different lessons of each of those that led you to this place?
Sure. I believe my answer to that question would just be my sheer desire to learn new things always. There's so many interesting things going on in the world, and whether you're able to harness that interest and turn it into, a business or something that you can love to do while being profitable at the same time, or if it's, just a series of, perfecting or getting to the point in one of these projects where, I've fulfilled, all of the goals that I was looking to do, and then, move on to something else new and exciting. That's kind of what allows me to continue to progress to different areas of growth and learning and business and startups.
And what would you say was your aha moment in terms of developing Sage Medical?
Sage Medical was sort of a necessary solution based on the fact that a lot of the systems that physicians are having to use, the data entry systems can be somewhat archaic. There's a lot of drop-down menus and clickies where they have to click on something to get to another page, and so on. It's very time-consuming and frustrating for physicians. So as I had continued to see or witness physician burnout, I realized, there must be a faster way that we can allow the physician to get the information they need into their system while eliminating the human error that's connected to that $100 billion a year worth of mistakes made in the biller and coder sector.
Were you, in terms of this being such a heavy tech platform, was that something that you felt intimidated by, or did you feel comfortable with? And how, and based on your answer, how did you move forward?
So the AI industry is amazing. It's so progressive and so quick to innovate that I wanted in. I wanted to be part of it. And AI turned out to be a perfect solution for what we're doing, because we're not making any attempt to replace the physician. We're just trying to automate a task that's very laborious to increase productivity for the physician, reduce burnout, and allow the medical coding and billing to be more streamlined, as well as being done in real time. So that I was not intimidated by the AI market itself, because I see this technology being implemented everywhere. But a big challenge related to that, as you mentioned, tech is not my background. So one of the tallest obstacles that we're seeking to overcome is hiring good fit developers and employee retention. So we need to procure like the best and the brightest if we want to, we want to keep them engaged on our journey. We want them to, to love this project. And quite frankly, medical coding is not a very sexy business. Most people don't know that medical coding is at the heart of, the healthcare industry. And there are problems associated with medical coding and billing industry, such as, honestly, it's just kind of a mess. Coding is a boring job. There's not enough medical coders. And, it's just a lengthy process that's prone to mistakes. So this particular solution, I think, is the right fit at the right time, using an experienced AI technology to automate, tasks that no one really wants to do.
Well, that's a great segue, if you will, into the other question that I wanted to ask you, which is about, what is the size of your team now, and where do you see the areas of growth in adding to your team?
So our team, we do have an executive board, and then we have a lot of our developers we outsource at the moment. As we continue to develop the product, we will start bringing on more and more in-house staff. But if you consider the people we outsource to as well, we're about a team of 15. And within that, or in addition to that, we have 4 channel partnerships with legacy EMR companies. So those are established electronic medical records companies that we've been working with.
Mm-hmm. And where does business development fall into your team building?
So the business will continue to develop as we continue to partner with additional EMR groups. Now we have a very interesting marketing strategy. Since we're directly integrated with those specific EMR groups, only the physicians on those platforms can use our software at the moment. So instead of us taking out ads on, like Google ads or something to that effect, which could reach millions of physicians who are, not on these 4 specific platforms, we realized early on that would really not be the best strategy for marketing. So instead, we work with medtech influencers. We work with advertising within that marketplace directly to the users in the EMR specific groups.
And so I guess based on that growth within those relationships, partnerships, if you will, there's not really, or is there room for a dedicated business development, like a salesperson, sales team that's in play for your future expansion?
There is. So there are hundreds of cloud-based EMR systems that we can continue to partner with. We also have a secondary strategy, which is called SDK licensing and white label software. So these groups can also basically lease our software and use it under their brand within their system.
So is the biggest revenue generator of the business recurring revenue from these licenses and or partnerships?
Correct.
And would there ever be alternate revenue streams that would extend past this? Is this a primary product that you're launching first with the idea of launching others, or is this the primary that will remain as it is?
So this particular platform, since it's a fully baked, 3-in-1 platform, I would say that this system would continue to work the way it's been designed to at its current stage. But we do have a secondary revenue market, which would be those medical coders we were talking about. So the medical coders, if they were to use our AI technology, they would be able to continue to log into physician notes, only they would read the physician note into our technology, and we would give them the answers to the question. We would generate the codes for them, which would allow them to nearly double the amount of coding they could do per day.
And what does a typical day in the life of you and this company look like? Just everyone always loves to hear some of the behind the scenes. And I'd love to know just what makes up a typical day for you.
The days are busy. I have 2 senior chihuahuas who are my personal assistants who are I believe underworked and overpaid, but I do love working from home. But the day is filled with often very interesting Zoom meetings, continued marketing strategies, expansion strategy, meetings with the developer team to see how can we improve this and increase that. So across the board, it's a pretty active day. I'd say 60 hours a week minimum for the last year and a half. So,
is this in consideration to the other ventures that you've been involved with? Is this your busiest in terms of time commitment, the 60 hours?
I would say it's equivalent to having been the founder of a national food franchise. That was very, very demanding as well. Not only because technology business, you can reach people through Zoom, and there's a lot of other platforms where you can exchange information. But with a national food franchise, you literally have to get on the plane and boogie on down to that location and assess what's going on, and retrain employees and staff, and there's shipping and product challenges and all sorts of things that you would face in not just one restaurant but a whole chain of restaurants. So I would say that was a much more stressful business to have been in, but it was an enjoyable business, and it showed us that that there can be a national vegan food industry like that. And here we are 10 years later, and there's vegan food available at most restaurants. So I'm thrilled to see that we were on the early upswing of that industry as well.
Yeah, I just actually saw a video today with one of my clients who was being interviewed by a chef that his name is Strike in New York City, who launched a franchise of fast food that's all plant-based. So I think, you're right. It's a much bigger trend than if it's getting into fast food franchising as plant-based, full-on plant-based fast food. That in New York, that was pretty fascinating for me to hear about that.
Yep, and I look forward to more of that type of plant-based industry, whether it be restaurant or, consumer foods. But yeah, I think that's definitely a trend that's not going to slow down anytime soon.
It might be less people needing to code medical reports as people eat more plant-based, right?
There are many reports to support that theory, absolutely.
Well, in terms of, because you've had, this wide array of time invested in growing these businesses, and like you were saying, there was a chapter of your life where it was more stressful because you were on planes and having to travel more and deal maybe more with human personnel. Now you have the responsibilities of growing and scaling a business that, even though you're working from home, is still really challenging with time. What are some of the things that you do as an entrepreneur to practice self-care and wellness for yourself?
That's a great question. So I live in the Denver, Colorado area, and there are amazing hot springs nearby. The Steamboat is an area that basically I love going to little spa getaway retreats, things of that effect, massage. Of course, healthy eating, things like that I feel are great ways to decompress and alleviate the stress that are very low impact as well.
Are you a big exercise person? Like with Denver, they have so many beautiful places to hike. I was just curious, are you an outdoors exercise person, indoor exercise person?
That is a good question. I think I would have spent more time outdoors had I not chosen a technical industry, because I need to be, I need to have a strong Wi-Fi signal and be near to a computer at almost all times. And so therefore I don't get out as much as I'd like to, but I do enjoy hiking and skiing and, things that are available here in Colorado.
So where do you find your biggest challenges in terms of, not And I'm a female entrepreneur asking a female entrepreneur, so this isn't about gender so much, but I am curious if there have been any specific challenges that you faced either in the tech world or in your previous chapters around being a woman entrepreneur, and if you faced any of those challenges, how did you overcome them?
Well, funding for female-led companies is, well, here's an example. So less than 4% of female-led companies are funded by VCs, venture capitalists. So we are making an effort to change that. In fact, I'm currently participating in a accelerator program that's hosted by a group of VCs called Expert Dojo out of Santa Monica, California, and their focus is funding women-led businesses as well as minority-led businesses, and that is a huge disruptor in a positive way, but it's definitely not what we've seen over the last decades as far as a focus for VCs. So I'm thrilled to be working with their accelerator program, and the more often we see that trending, I feel the better and wider variety of business expansion that will be available. So the more investors in general focus or turn a focus to investing in women-led businesses, minority-led businesses, I think we'll see the market grow exponentially.
Question we have: who's your competition?
Who is my competition? Oh, that's a good one.
Besides Ask Brian. Go ahead.
Okay. So currently there are products on the market. So there is a system on the market that's used specifically by medical coders that would allow a coder to read a patient entry and then choose the correct word and then basically cut and paste that word into this other platform. The platform will generate a code for them. But what makes our system different is we also have a transcription tool and we have a billing tool combined, whereas, in addition to our ability to automate the coding, there are several systems on the market who can do your billing. Again, it takes a lot of, manual entry, and it also would require you to already have had someone create the medical code for you. For our system, it's seamless. We have it. It's a seamless medtech solution that can continue to innovate, as well as there are, of course, dictation tools on the market. If you have a cell phone and you want to send a text message, but you don't want to type it out, you can, of course, dictate it, right? And it'll transcribe it for you. So there are systems like that on the market, but again, they kind of stop at just performing that one task. So our system is different. So my overall response would be there are many systems on the market that do one of the three things that we do, but I have yet to find one that has combined all three into one fully baked product.
Super. Tracy?
Well, when we were talking during the break, you mentioned that there's a lot of collaboration going on in medtech with the founders. That's really interesting. Can you share more about that?
Absolutely. A few months ago, we participated in the Salesforce Accelerator program, and I was thrilled to meet the other participants in that cohort because everybody was sharing information. So I was, just very inspired by that. And I feel the reason that so many of the medtech founders and products that are coming to market are working together is simply we can get to the finish line faster, we can innovate more quickly, and it's really pressing the envelope for innovation. So if we work together and combine our systems and come forward with a really complete solution, we can bring this to market more quickly and essentially assist physicians and hospitals much faster.
And if someone wanted to get in touch with you, we want to make sure before we have to close out the show, we want to make sure we give people the opportunity if they want to engage with Sage Medical or they want to get in touch with you for future collaborations of any sort. How would they reach you?
That would be great. I'd love to hear from anyone who's interested in this product or the process. Our website is www.sagemedical.io, and you can reach us by email at info@sagemedical.io.
and if you were to provide a takeaway tip for someone that was in just starting something new or just in the tech world, what is a tip that you would provide for entrepreneurs out there?
Collaboration is an absolute key to success. Don't get frustrated. Keep going forward. It can be very frustrating to not have a win right out of the gate, but don't give up. Just keep working forward. And the technology's there. Just work with it and keep moving forward.
Before we go any further, what do you think is going to be the way that you're going to be able to scale this?
I think this will scale more quickly with our ability to vertically integrate with all of the used systems. So to connect to each of these systems and implement our software within their operating EMR can happen very quickly in a day or so. So the quicker we form the channel partnership agreements and are able to bring this to market within their systems, that will show our growth exponentially.
So the last question, we're going to have to make it really quick. Compatibility, right? So if I'm a coding billing and I'm doing that, can I just pick up this software and run it really quick, or is there a learning curve there?
No, as a physician, you simply press the record button. You speak whatever you'd like, as a patient record into our system, and we take it from there. You press record, speak, stop the recording, and we automate everything from there.
Thank you very much. The show's over. Thank you very much for your time. KHS 1220 98.1 FM, the Ask Brian Radio.
Thank you for tuning in to the Ask Brian Radio Show. You can listen to us every Thursday on KTHS AM 1220 and FM 98.1 or via Facebook Live or anytime wherever you listen to your podcasts. Visit AskBrian.com to join the conversation and ask us your business questions, and we'll answer them on our next episode. That's AskBrien.com.